Welcome to the GEMS Product Pod, brought to you by Clarion Events Fire and Rescue Group and the Journal of Emergency Medical Services. My name is Ted Lee. I am the editor-in-chief of GEMS, along with Jeff Frankel, the managing editor. We will be bringing you products, the latest equipment, technology and gear from pre-hospital medicine, and things that are used in the EMS environment. Today, we are looking at WEINMANN Medical Technologies, based out of Germany with an office in Atlanta, Georgia, and their MEDUMAT EasyCPR emergency ventilator. So straight out of the box, you have a couple things. Of course, you have a quick reference manual that you would use for easy setup and daily checkoffs of the device. You have your main manual that will help ensure proper use and all of the information that you would need to use this device. Next piece of equipment out of the box is your test lung. You have a silicone test lung to use for your daily checkoffs to ensure that pressure and ventilation rate and tidal volume are accurate. The next item out of the box, which is pretty unique for this one, is an actual trigger device for this. This item slides over the mask that you would use, has two buttons here for manual control of ventilatory assistance. And then the simple push-pull device pushes into the control module itself, which I'll show you in just a second, for easy use. This ensures that two hands are always on the bag or the mask that you are using. But what is interesting about this piece of equipment, it's not just suitable for the mask itself. It can be hooked up to an ET tube or a supraglottic airway and work just as well. Next thing out of the package is the circuit tube. For those of you who have experience with ventilators, this circuit tubing is pretty familiar to you. Has a typical setup where the mask or the supraglottic airway or the ET tube would attach. It has a high pressure tube, and then it has the ventilatory tube as well. And then on the side of the device, if you have a PEEP valve, you could attach that as well. As you see on the inside, it has pop-off valves for pressure as well to help control the pressure. On the back end of the tubing, you have one size fits each one, your high pressure tubing, and then your ventilatory tubing as well. When I show you the device, you'll see where it attaches. And then the last piece of equipment out of the box is the device itself. You can see that this is very small, portable, and weight is not an issue for you at all. On the back, it has a strap hookup, so it can be attached either into a bag or onto the side of the stretcher to secure it. On the far side, you have your pressure port or your pressure hose that comes in. Usually this is a standard green hose that comes from your oxygen bottle or from your main line for your system. On the other side, it has a speaker. This does talk to you and give warning, and then it has the battery for it. Battery life for this is estimated about 100 uses before it needs to be changed. So you get a lot of use out of this. On the bottom of the device, this is where the trigger port goes in, and it just slides right in, line up red line to red line, and it'll slide right in. And then you have your two ports for your tubing. So as you see here, you have your high pressure tubing, and then you have your ventilation tubing as well. And then I mentioned before that the trigger pushes right in through here. Very unique about this device, of course, a single person can use it. Two hands on the mask or a tube holder device for your supraglottic and your ET tube goes in place. A single knob controls both ventilations and tidal volume for this. Red is for the adult, orange is for your pediatric. So single knob controls both. It does have your on-off switch, and then it has your pressure gauge. It has your pressure gauge here. As it ventilates the patient, you will see the pressure rise as well. It has a manual if you want to give an additional ventilation, or it can be done on the triggers, like I showed you earlier. It does have a series of alarms. It has a high pressure alarm, so you won't overpressurize your patients. It does have a low pressure or an apneic alarm for the patient as well. It has an alarm for the mainline oxygen tubing. If your bottle's running low, or there's a problem with your hardline O2 connection, it will pick that up. And then, of course, a battery warning as well. And then orange, again, is for pediatrics. Red is for adults. So very easy to use, very safe and effective, very consistent ventilations and tidal volumes as well. Again, it goes through the typical circuit, can be used with a mask, can be used with a supraglottic airway or an ET tube. Heavily tested in Europe and widely used in Europe as well. The safety of these devices has gone up quite a bit through the research and development of that, especially with the pressure alarms. So we know that through a lot of research, manual ventilations at times can be very inconsistent and run the risk of overpressurizing or underpressurizing the lungs, and this device will take care of that. So the human error aspect of this is removed, and you have more control over the airway and more consistent, safe and effective ventilations for your patient. This also, what's really unique about this, it has the consistent ventilation that is controlled by the knob. It has manual ventilation, like I mentioned, with the trigger or the manual here on the side of this, or it has a demand where if the patient is breathing, you can put it on demand mode, and through the negative pressure, it will initiate breaths for the patient every time the patient breathes. So a very nice and effective piece of equipment. Very small and very user-friendly, easy to carry, doesn't take up a lot of room, and allows you to free up another provider for other services and have one person focusing on ventilations. So this is the WEINMANN Medical Technologies MEDUMAT EasyCPR emergency ventilator. For more information on WEINMANN Emergency Medical Technologies and the MEDUMAT EasyCPR, you can go to weinmann-emergency.com/US.